Speaker of the House Paul Ryan says the American Health Care Act is the right way to repeal and replace Obamacare. Here he is today making the pitch.
Lower costs, more choices, not less, patients in control, universal access to care. These are the four driving principles that we are focused on: lowering the costs, giving people more choices, having patients in control, and universal access to care. Let me walk you through how exactly we propose to do this.
The Speaker insists he can get the bill through Congress, but apparently a lot of Republican senators did not get that memo. The biggest critic is Senator Rand Paul of Kentucky, who says the bill is dead on arrival and will destroy the party in 2020 if it's passed. Senator Paul joins us now. It's good to see you.
Well, you know, he left out a few things in the press conference. He left out that he keeps the Obamacare taxes for a year, then he keeps the Cadillac tax forever. He keeps the Obamacare subsidies, but renames them, tax credits. He keeps the individual mandate, but you don't have to pay the government the penalty. You got to pay the insurance company the penalty, and then he also.
But they would say there's a transition.
Well, no, but he's keeping aspects of Obamacare. That's the very definition of Obamacare Lite.
So it's not a full repeal, is your point?
No, it's not. And about a year ago, we did. We voted unanimously a year ago. Why aren't we voting on what we voted a year ago?
But I've spoken to House Republicans, and they told me to ask you this simple question. You want to repeal it. What happens after that? You do a full repeal. They say the market collapses, and you really do have a death spiral. And then you, Senator Paul, you own that death spiral.
Yeah, no, I'm for replacing at the same time.
How do you replace it immediately,
then? Well, in a separate bill. I've written the bill. And the bill is, interestingly, mostly Tom Price's ideas. So it's interesting that you have Paul Ryan on one side saying, I have Tom Price's ideas, and then you have Rand Paul on the other side saying, I have Tom Price's idea. And it's kind of true. But we don't like the refundable tax credits that came from Tom Price, but we do like health care associations where you can join like a buying pool or a group to bring down prices. This is part of the answer because the 11 million people in the individual market, their premiums are going through the roof. So you got to let them join a buying pool.
But House Republicans say the premiums are going to spike even more once you repeal it altogether.
Well, that's why you replace it. And what you replace it with are market reforms. We get rid of the mandates, which I think Paul Ryan would agree with. You expand health savings accounts, and then you expand to healthcare associations. These associations are like co-ops or buying pools.
All great ideas, but House Republicans also tell me that you can't get to 60 votes with that. So it's not going to go anywhere.
I can't be blamed if somebody won't vote for something. It's not a bad idea.
But how do you bring Democrats in, is their point, to get to 60 votes?
Well, we have to convince people that it's a good idea, and we bring it forward. But the problem is they've brought forward things that are very controversial and that conservatives don't like. Conservatives hate their bill. I promise you, Obamacare Lite, dead on arrival. They might as well just start over. You're hearing other voices. I'm not the only voice saying this. And so what they should do is clean it up, get rid of the Obamacare Lite stuff, get rid of the taxes, the subsidies, the mandates, the bailouts,
I've pushed you on
just do repeal.
What they say is wrong with your idea. In your support, Republican Senator Tom Cotton today basically agreed with you and said that the House Republicans may wind up with something that's worse than Obamacare. And so the Speaker said, however, you're making a binary choice, Senator. If you don't do this, you're not really following through on the promise to repeal and replace Obamacare.
Let me translate what it means. When someone tells you have a binary choice, they're telling you take it or leave it. The Speaker needs the Speaker needs to like bring people into the room, conservatives, and needs to hear what we want. We are withholding our vote. This is a message for the Speaker. We are withholding our vote. We want a seat at the table, and it's not a binary choice. If we do not understand why we're in a death spiral with Obamacare, we can't fix it. The reason we're in a death spiral is we're telling people you can buy insurance after you get sick. So guess what? People are waiting to buy it until after they get sick. And that still happens after Paul Ryan's plan. He doesn't fix that problem
at all. But the Vice President is now going to your home state on Saturday. It sounds like the administration is trying at least to brush you back a little bit. React to that, but also when you say, look, it's not a binary choice, you don't have my vote, Mr. Speaker, you might imperil the Trump presidency.
Well, no, not at all.
Well, what if this all comes crashing down?
I'm a big friend of the president.
But this may come crashing down.
And also, you won't meet anybody who dislikes Obamacare more than me. I'm a physician. I have lived Obamacare. It is a disaster. I have voted to repeal it, and I will vote again. But I will not vote for Obamacare Lite stuck on the repeal bill. We're going to have to separate repeal from replace. We have disagreements, serious, fundamental policy disagreements with the Speaker. We're going to have to separate repeal from replacement or the deal doesn't get done.
Senator Paul making no bones about where he stands tonight. Thank you, sir.
Yes, thanks.